Imagine if your doctor could design a treatment plan specifically for you, not just based on your genetic code, but on how your genes are currently behaving. That's the promise of epigenetic fingerprinting, a groundbreaking approach in personalized medicine that looks beyond DNA to understand how lifestyle, environment, and even past experiences shape your health. But what exactly does that mean? And how can it revolutionize healthcare? Epigenetics is the study of changes in gene expression that don't alter the underlying DNA sequence but can still have a significant impact on our health. These changes are influenced by factors like diet, stress, pollution, and aging, which can switch genes on or off. Epigenetic fingerprinting is like a health detective tool that analyzes unique chemical modifications on your DNA, such as DNA methylation and histone modifications, to create a personalized snapshot of how your genes are functioning at a given time. Why is this important? Because two people with the same genetic predisposition for a disease might respond to treatments differently based on their epigenetic profile. For example, someone with epigenetic markers linked to chronic inflammation might need a completely different therapy than someone without these markers, even if both have the same genetic mutation. This precision allows doctors to customize treatments, avoid unnecessary medications, and focus on therapies that are most likely to work for an individual. Think of it like tuning a piano. Your DNA provides the keys, but epigenetics determines how they are played. Factors such as lifestyle and environment can retune your genes over time, and understanding these changes helps doctors personalize prevention strategies, medications, and lifestyle interventions. Epigenetic fingerprinting has already shown promise in areas like cancer treatment, cardiovascular disease, and neurodegenerative disorders. In oncology, for example, identifying specific epigenetic changes in tumors helps doctors choose targeted drugs that work best for a particular cancer subtype. Similarly, in mental health, epigenetic profiling can provide insights into how stress or trauma has impacted gene function, leading to more tailored therapeutic approaches. However, challenges remain. Epigenetic changes are highly dynamic, meaning they can shift in response to treatment or changes in environment, making long-term monitoring essential. Additionally, ethical concerns arise regarding the privacy and interpretation of epigenetic data, how mice should be shared, and how might it affect things like insurance coverage. Despite these challenges, epigenetic fingerprinting represents an exciting step toward truly personalized medicine, where treatments are not just based on generic guidelines, but fine-tuned to an individual's unique biological story. So, could this be the future of healthcare, where medicine is as unique as your own epigenetic fingerprint?
Epigenetic fingerprinting refers to the unique pattern of chemical modifications to an individual's DNA and associated proteins, which regulate gene expression without altering the underlying genetic code. These modifications include DNA methylation, histone modifications, and non-coding RNA molecules, all of which play crucial roles in determining which genes are active or silent. Unlike genetic mutations, epigenetic changes are dynamic and reversible, influenced by environmental factors such as diet, stress, toxins, and lifestyle choices. The study of these unique patterns enables researchers to develop personalized medical strategies based on how an individual's genes are expressed, rather than just their genetic sequence. For instance, two people may have the same genetic predisposition for obesity, but one might develop the condition while the other does not. Epigenetic fingerprinting can reveal that dietary habits and exercise have modified one individual's gene expression, preventing the activation of obesity genes. Imagine your DNA as a piano with a fixed set of keys. Genes. Epigenetic changes act like a pianist, deciding which keys to play, genes to express, and which to leave silent, creating different melodies or biological responses in each person. Traditional medicine often follows a generalized approach to treatment, assuming that the same treatment will work for everyone. However, epigenetic fingerprinting provides a much deeper understanding of how each person responds to treatment based on their unique gene expression profile. This allows for highly personalized medical interventions tailored to an individual's specific health needs. By analyzing epigenetic markers, doctors can determine which treatments are likely to be most effective, reducing the trial and error approach and minimizing potential side effects. In cancer treatment, patients with the same type of cancer might respond differently to chemotherapy. Epigenetic fingerprinting can identify which patients will benefit from chemotherapy and which would respond better to targeted immunotherapy based on the activity of tumor-suppressing or promoting genes. Think of medicine like clothing. Traditional medicine offers a one-size-fits-all approach, but personalized medicine tailors treatments to fit the unique measurements of an individual's biology. One of the most promising aspects of epigenetic fingerprinting is its ability to serve as an early warning system for disease development. Epigenetic changes often occur before physical symptoms manifest, making it possible to detect conditions like cancer, diabetes, and neurodegenerative diseases at an early stage. By identifying these biomarkers, doctors can recommend lifestyle changes or preventive treatments to reduce the likelihood of disease progression. This proactive approach shifts healthcare from reactive to preventive. A person showing early epigenetic markers for heart disease might be advised to adopt a heart-healthy lifestyle with dietary changes, exercise, and stress management to prevent plaque buildup in arteries before any clinical symptoms develop. Epigenetic fingerprinting is like a weather forecast, detecting early signs of a storm before it strikes. Epigenetic modifications are highly influenced by external factors such as nutrition, physical activity, exposure to toxins, sleep patterns, and stress levels. These factors can turn genes on or off, influencing overall health. Healthy lifestyle choices can enhance beneficial gene expression, while harmful habits can trigger the expression of disease-associated genes. Understanding these interactions allows individuals to make informed choices that positively impact their epigenetic profile. A person who consistently consumes a diet rich in fruits, vegetables, and whole grains may experience epigenetic modifications that suppress inflammation genes, lowering their risk of developing chronic diseases such as diabetes and cardiovascular disease. Your genes are like a garden, and lifestyle choices are the water and sunlight. Good habits nourish the plant's genes, while bad habits introduce weeds that can take over. People respond differently to medications due to variations in their epigenetic profiles. Some drugs may be highly effective in one person but cause adverse reactions or have no effect in another. Epigenetic fingerprinting allows healthcare providers to analyze an individual's gene expression patterns to predict drug metabolism, efficacy, and potential side effects, ensuring personalized treatment that maximizes benefits while minimizing risks. A patient with depression may not respond to standard antidepressants due to epigenetic modifications that influence neurotransmitter pathways. Analyzing their epigenetic profile can help doctors select a medication that aligns with their unique biology. It's like cooking a dish. You need the right ingredients for your specific taste, biology. Otherwise, the dish might turn out too bland or too spicy. Cancer often arises due to abnormal epigenetic changes that silence tumor suppressor genes or activate oncogenes, leading to uncontrolled cell growth. By identifying these changes through epigenetic fingerprinting, researchers can develop targeted therapies that reverse harmful modifications, offering more precise and effective treatment options. This approach also helps in monitoring cancer progression and response to therapy. Epigenetic drugs, such as DNA methylation inhibitors, can reactivate silenced genes that suppress tumor growth, restoring the body's natural defenses against cancer. Think of it like restoring a locked safe. Epigenetic drugs act like the key that unlocks tumor-suppressing functions previously hidden by abnormal gene silencing. Genetic testing provides a static snapshot of an individual's inherited DNA, while epigenetic fingerprinting offers a dynamic view of how genes are regulated and influenced by environmental factors. Genetic predispositions alone do not guarantee the development of diseases, but epigenetic fingerprinting can provide real-time insights into gene activity and potential health risks based on lifestyle and environmental exposures. Two individuals with the BRCA1 gene mutation linked to breast cancer might have different cancer risks depending on their epigenetic markers, which are influenced by factors such as diet and stress management. If DNA is like the blueprint of a house, epigenetics is like the daily maintenance. Just because the blueprint suggests a strong structure doesn't mean poor upkeep won't lead to problems. Aging is closely linked to epigenetic changes that accumulate over time, such as the loss of beneficial gene expression and increased DNA damage. Scientists are exploring interventions like dietary changes, exercise, and targeted therapies to reverse or slow down these changes, promoting longevity and better health in old age. Studies show that calorie restriction and regular exercise can positively affect epigenetic markers associated with longevity, potentially slowing down biological aging. Aging is like rust on a car. Proper maintenance and care can keep it running smoothly for a longer time. Epigenetic fingerprinting raises ethical concerns related to data privacy, potential misuse of genetic information by employers or insurance companies, and accessibility of personalized treatments. As this technology advances, regulations and ethical guidelines must ensure fair and responsible use. If epigenetic data becomes publicly accessible, individuals with markers for certain diseases might face discrimination when applying for jobs or insurance coverage. Sharing your epigenetic data is like revealing your personal diary. It contains sensitive information that could be misused if not properly protected. Epigenetic fingerprinting offers a revolutionary approach to personalized medicine by tailoring treatments to an individual's unique biological response. By understanding how genes are regulated by lifestyle and environment, healthcare can shift from reactive to preventive, ultimately improving patient outcomes and quality of life.